Welcome to a comprehensive guide on posology and dosage regimens, presented by Dr. Santosh Kumar Singh from ICFI School of Pharmaceutical Sciences. This presentation will delve into the science of dosing medications, a crucial aspect of patient care. Our objectives today include defining posology, mastering dosage calculations, identifying key factors affecting dosages, and designing effective regimens to maintain therapeutic drug concentrations. Posology is the cornerstone of pharmacotherapeutics, bridging the gap between drug discovery and effective patient treatment. It ensures treatment efficacy, patient safety, therapeutic outcomes, and prevention of adverse drug reactions. Proper dosing is vital, with over 7,000 annual deaths and 1.3 million injuries due to medication errors in the US alone. Accurate dosing is essential for patient safety and optimizing therapeutic outcomes. Posology, derived from Greek, is the branch of medicine dealing with doses. It encompasses the principles of dose determination, frequency, and duration, ensuring the intended medicinal effect. Multiple factors affect drug dosage, including patient, clinical, and pharmaceutical factors. These influence the optimal drug dosing necessary for effective treatment. The dose-response curve illustrates the relationship between drug dose and biological effect, crucial for determining proper dosage. Variability in population response must be considered for efficacy and safety. Age significantly affects drug dosing. Pediatric and geriatric considerations are crucial due to differences in drug metabolism and elimination, impacting drug accumulation and toxicity. Young's rule provides a guideline for pediatric dosage calculations, adjusting adult doses based on age. However, precise calculations based on weight or BSA are preferred for accuracy. Additional pediatric dosage rules like Cowling's and Fried's rules offer methods for calculating doses for children, emphasizing the need for age-appropriate dosing strategies. Body weight is a critical factor in dosing, influencing drug concentration at the site of action. Weight-based dosing is often more accurate than age-based formulas, especially for non-average individuals. Clark's rule offers a weight-based dosing method, normalizing doses relative to a standard adult weight. This is particularly useful for drugs with narrow therapeutic indices. Body surface area, BSA, is significant in dosing, correlating with various physiological processes. It's considered the most accurate method for calculating pediatric and anti-cancer drug doses. Using a nomogram, BSA can be determined for precise medication dosing, enhancing accuracy in drug administration. BSA-based dosing is the gold standard in chemotherapy and clinical trials, offering a more proportional approach to drug surface area than weight or age. Sex differences affect drug dosing due to physiological variations. Special considerations are necessary for women, especially during menstruation and lactation, to avoid adverse effects. Pregnancy and lactation require careful drug administration due to potential fetal risks and drug transfer through milk. Understanding these considerations is crucial for maternal and infant safety. Pathological conditions can modify drug effects, necessitating dose adjustments. Warnings and precautions in drug labeling guide these adjustments for specific conditions. Clinical responses to warnings include monitoring serum levels and adjusting doses. Contraindications highlight drugs that should not be used due to severe adverse event risks. Drug tolerance affects dosing, requiring higher doses to achieve the same effect. Understanding true and pseudo-tolerance is essential for managing drug administration effectively. Drug tolerance is a common occurrence with various medications, including antihistamines and narcotic analgesics. To manage tolerance, strategies such as initiating therapy with the lowest effective dose and avoiding prolonged administration are crucial. These approaches help minimize the development of tolerance and ensure effective treatment. Tachyphylaxis refers to a rapid decrease in drug response after repeated administration over a short period. Unlike regular tolerance, this decreased response cannot be reversed by increasing the dose. Mechanisms include receptor desensitization, and clinical examples involve drugs like ephedrine and cocaine, which show diminished effects with repeated use. Drug-drug interactions can significantly alter the effects of medications. These interactions may be beneficial, detrimental, or additive, requiring careful dosage adjustments to maintain safety and efficacy. Understanding the mechanisms and types of interaction effects is essential for optimizing therapeutic outcomes. Drug interactions can be beneficial or detrimental. For instance, probenecid prolongs penicillin serum levels, while tetracyclines can interact with metal ions, affecting absorption. Recognizing these interactions helps in adjusting dosages and schedules to ensure effective treatment and minimize adverse effects. Food, drug, and lifestyle drug interactions can significantly impact drug efficacy and safety. Certain foods and lifestyle factors, such as smoking, may alter drug absorption and metabolism. Conducting a comprehensive medication review is vital to identify potential interactions before establishing a dosage regimen. The timing of drug administration can influence absorption and gastric irritation. For example, evening administration of statins is more effective due to circadian rhythms. Understanding chronopharmacology helps optimize dosing schedules for different medications, enhancing therapeutic efficacy. The route of drug administration affects bioavailability and the required dose. Intravenous administration ensures full absorption, while oral routes may require higher doses due to incomplete absorption. Adjusting the route can optimize drug levels and therapeutic effects. Physiological factors like body temperature and electrolyte balance can modify drug effects and dosage requirements. For instance, hypokalemia increases digoxin toxicity. Adjusting dosages based on these factors is crucial for maintaining therapeutic efficacy and safety. Idiosyncrasy, or drug allergy, is an unpredictable response to a medication. These immune-mediated reactions can be severe, such as anaphylaxis. Obtaining a thorough allergy history is essential before prescribing new medications to prevent adverse reactions. Environmental factors like daylight and altitude can affect drug metabolism and responses. For example, hypnotics are more effective at night. Considering these factors when establishing dosage regimens can enhance therapeutic outcomes, especially for medications affecting the central nervous system. Psychological factors, including the physician's personality and patient relationships, can influence drug treatment. Positive interactions may enhance medication efficacy, while placebos demonstrate the power of psychological effects on treatment responses. Understanding these impacts is crucial for optimizing therapeutic strategies. Drug accumulation occurs when drugs are slowly excreted, leading to toxic concentrations. Examples include digitalis and heavy metals. Monitoring elimination rates and adjusting dosages can prevent toxicity and ensure therapeutic safety. Additive effects occur when the combined action of drugs equals the sum of their individual effects. This can improve treatment outcomes, allowing lower doses and maintaining efficacy. Understanding additive effects is essential for optimizing drug combinations. Drug antagonism occurs when one drug opposes another's action. This can be chemical, physiological, or competitive, such as naloxone blocking opioid receptors. Recognizing antagonism is vital for managing drug interactions and optimizing therapeutic strategies. Dosage form and physical state significantly impact drug absorption and bioavailability. Factors like particle size and formulation influence therapeutic effects, requiring adjustments to maintain efficacy and safety. A dosage regimen specifies the dose amount, frequency, and duration of treatment. Proper selection ensures therapeutic plasma concentration is achieved and maintained, balancing efficacy, safety, and patient adherence. The drug concentration time curve illustrates key pharmacokinetic concepts, including MEK and MTC. Understanding the therapeutic range helps design effective dosage regimens, ensuring drug levels remain within safe and effective limits. The therapeutic index measures drug safety, comparing minimum toxic and effective doses. A lower index requires precise dosing and monitoring to prevent adverse effects. Understanding this index is crucial for safe drug administration. Effective dosage regimens aim to maintain drug plasma concentration within the therapeutic range. Suboptimal dosing can lead to under-medication or resistance. Careful design ensures therapeutic efficacy and minimizes risks. Suboptimal dosing occurs when drug concentration falls below the minimum effective level. This can lead to inadequate treatment and inconsistent drug effects. Visualizing these patterns helps identify and correct dosing issues for continuous therapeutic coverage. To achieve the best therapeutic effect, it's crucial to understand the optimal dosing strategy. This involves calculating the half-life to know how long the drug remains in the body, setting the dosing interval to match one elimination time, determining the dose size based on therapeutic range, and considering a loading dose for rapid therapeutic levels. Balancing efficacy and safety while considering patient convenience is key. In an optimal dosing pattern, each dose is given before the previous one is fully eliminated, allowing the drug to accumulate until a steady state is reached, typically after 4 to 5 half-lives. At this point, the rate of administration equals the rate of elimination, maintaining drug concentration within the therapeutic range and ensuring continuous therapeutic effect, ideal for chronic conditions. Understanding dosage statements is essential for effective treatment. The usual dose refers to the expected medicinal effect in adults, while the usual dosage range is the amount prescribed within recognized medical practice. Doses outside this range may be ineffective or toxic, highlighting the importance of individualized patient care based on specific factors. Dosage regimen is the schedule for administering drugs, often at specific intervals like every 8 hours or before meals. Initial, loading, or priming doses are large single doses given to achieve peak plasma concentration quickly, followed by maintenance doses to keep levels steady. For example, digoxin is administered initially and then maintained to ensure desired blood levels. Final dosage concepts include maintenance doses, prophylactic doses, and therapeutic doses. Maintenance doses keep drug levels steady, prophylactic doses prevent infections, and therapeutic doses treat conditions. Effective pharmacology requires understanding principles, assessing patient-specific factors, knowing drug properties, and monitoring clinical response for adjustments. Thank you for your attention. For further inquiries, feel free to contact via email or visit the YouTube channel for more information. We appreciate your interest in pharmacological sciences and hope this presentation has been informative.